Imagine if your high blood pressure isn't a life sentence, but a warning sign your body is asking for help. What if the same heart that's struggling today could begin healing itself naturally starting this week? Most people are never told this, but hypertension can often be reversed when you fix the root causes, not just the numbers. High blood pressure didn't appear overnight. It crept in silently, year after year, shaped by stress, food choices, sleep patterns, and habits we were told were normal. And that's the first truth you need to understand. Hypertension is not just a heart problem, it's a whole body signal. As a cardiologist, I've seen two very different futures. One where people add more pills every year, watching their numbers bounce up and down. And another where patients take control, lower their pressure naturally, reduce medications, and feel younger than they have in decades. The difference isn't genetics or luck. It's understanding what actually drives blood pressure up. Blood pressure rises for three main reasons. First, your blood vessels lose flexibility. Healthy arteries are meant to expand and relax with every heartbeat. But inflammation, sugar overload, and chronic stress make them stiff like old rubber hoses. When vessels can't relax, pressure skyrockets. Second, your body holds onto excess fluid and sodium. This increases the volume of blood your heart has to push. More volume means more pressure against vessel walls. And no, this isn't just about salt. It's about how insulin, processed foods, and hormones confuse your kidneys into holding water they don't need. Third, your nervous system gets stuck in fight or flight. When stress hormones stay elevated, your heart beats harder, vessels constrict, and blood pressure stays high even while you're resting. This is why so many people with hypertension feel anxious, tired, and wired at the same time. Here's the mistake most people make. They try to fix high blood pressure by focusing only on the numbers. They check readings obsessively but never ask why the pressure is high in the first place. Medication can be helpful, and sometimes necessary, but it does not reverse the underlying damage. Reversal begins when you change the internal environment of your body. Let's start with the most powerful and underestimated factor: inflammation. Chronic, low-grade inflammation damages the lining of your blood vessels, called the endothelium. When this lining is irritated, it releases chemicals that cause constriction instead of relaxation. Over time, this alone can push normal blood pressure into dangerous territory. What causes this inflammation? Highly processed carbohydrates, excess sugar, seed oils, smoking, and sitting too much. But also poor sleep and constant mental stress. The body does not separate emotional stress from physical danger, it reacts the same way. The good news is this damage is not permanent. Blood vessels can regain flexibility within weeks when inflammation drops. Studies show that improving diet quality alone can lower systolic blood pressure by 10 to 15 points, sometimes more, without a single pill. The foundation is food, but not in the way you've been told. This is not about eating less, it's about eating differently. When you reduce ultra-processed foods and stabilize blood sugar, your arteries relax, your kidneys release excess fluid, and your heart doesn't have to fight as hard. One simple shift makes an immediate difference. Replacing refined carbohydrates with fiber-rich, mineral-dense foods. Vegetables, beans, nuts, seeds, olive oil, and clean proteins provide potassium, magnesium, and antioxidants, nutrients that directly signal blood vessels to relax. Potassium, in particular, counterbalances sodium. It helps your kidneys excrete excess salt and reduces pressure on artery walls. This is why populations that eat whole foods naturally have lower blood pressure, even when they don't restrict salt aggressively. But food alone isn't enough if stress chemistry stays elevated. And this is where most advice completely fails people. You cannot out-diet chronic stress. When cortisol and adrenaline stay high, your body prioritizes survival over healing. This is why slow breathing, walking, and sleep aren't soft advice, they are cardiovascular medicine. Just 5 minutes of slow nasal breathing can measurably lower blood pressure by activating the parasympathetic nervous system. Walking after meals improves insulin sensitivity and reduces fluid retention. Deep sleep repairs blood vessels and resets stress hormones. Hypertension improves fastest when the body feels safe again. In the next part, I will explain the exact daily habits that reverse high blood pressure at the cellular level and why many healthy routines are secretly keeping your numbers high. To reverse high blood pressure, your daily habits must send one clear message to your body: there is no emergency. When that message becomes consistent, blood pressure drops naturally because the body no longer needs to defend itself. Let's talk about movement because this is where many people unknowingly sabotage their progress. Intense exercise is often praised as the gold standard for heart health, but for someone with uncontrolled hypertension, pushing too hard can temporarily spike blood pressure and reinforce stress signals. This doesn't mean exercise is bad. It means the type and timing matter. The most effective movement for lowering blood pressure is rhythmic, low-impact activity done consistently. Walking, cycling at a comfortable pace, swimming, or gentle strength training all improve vessel elasticity. These movements increase nitric oxide production, a molecule that tells blood vessels to relax. Over time, this improves circulation and lowers resting pressure. A simple daily goal that works better than most gym routines is 30 to 40 minutes of walking, especially after meals. This improves glucose control, reduces insulin resistance, and prevents fluid buildup. When insulin levels stay lower, the kidneys stop holding unnecessary sodium. Blood volume decreases, and pressure falls naturally. Sleep is another non-negotiable pillar of reversal. Poor sleep raises blood pressure, even in young, healthy people. When sleep is short or fragmented, cortisol stays elevated, inflammation increases, and the nervous system never fully powers down. Many patients work hard on diet and exercise but see little improvement simply because they are sleeping 5 or 6 hours a night. The body does most of its vascular repair during deep sleep. This is when arteries recover, stress hormones drop, and blood pressure resets for the next day. Improving sleep quality alone can lower systolic pressure by 5 to 10 points. That's equivalent to a medication without side effects. One overlooked factor is breathing during sleep. Mouth breathing, snoring, or untreated sleep apnea keep oxygen levels unstable and trigger nightly spikes in blood pressure. Even mild breathing issues can block progress. Learning to breathe through the nose, improving sleep posture, and addressing airway health can dramatically improve nighttime blood pressure patterns. Now let's address salt because this topic is often misunderstood. Salt is not the villain it's made out to be. In fact, extremely low sodium intake can backfire by activating stress hormones and increasing insulin resistance. The real issue is salt sensitivity, which is driven by inflammation, poor kidney signaling, and low potassium intake. When you fix the underlying metabolic issues, the body handles salt appropriately. Whole food diets naturally balance sodium with potassium, magnesium, and water. This is why traditional diets around the world included salt without widespread hypertension. The problem is processed food salt, not natural seasoning. Another critical factor is hydration. Dehydration paradoxically raises blood pressure by increasing stress hormones and thickening the blood. Drinking enough water throughout the day helps maintain healthy blood volume and reduces strain on the heart. When hydration improves, the body stops clinging to sodium and fluid. Alcohol also deserves attention. Even moderate drinking can elevate blood pressure by stimulating the nervous system and impairing sleep. Reducing or eliminating alcohol often produces rapid improvements, sometimes within a week. Now let's talk about medications because this matters. Many people worry that lifestyle changes mean abandoning medical treatment. That's not true. Medications can protect the heart while reversal is underway. But when the root causes are addressed, many patients under medical supervision are able to reduce dosages or even discontinue certain drugs safely. The goal is not rebellion against medicine. The goal is recovery. And here's something rarely discussed. Blood pressure responds more to consistency than perfection. Skipping one workout doesn't matter. Eating one unhealthy meal doesn't matter. What matters is the overall pattern your body experiences every day. When healthy signals outnumber stress signals, healing begins automatically. In the final part, I'll explain how to track progress correctly. Avoid the most common reversal mistakes, and understand when high blood pressure is truly improving, even before the numbers fully reflect it. One of the biggest mistakes people make while trying to reverse high blood pressure is relying on a single reading to judge success or failure. Blood pressure is dynamic. It changes with sleep, stress, hydration, posture, and even the time of day. A single high number does not mean your plan isn't working, and a single low number doesn't mean the problem is solved. True improvement shows up in patterns. Morning readings gradually come down. Spikes after stress become smaller. Resting heart rate decreases, energy improves, headaches fade. Sleep deepens. These are early signs that your nervous system and blood vessels are healing, even before blood pressure fully normalizes. Another common mistake is overchecking. Constant monitoring can increase anxiety, which ironically raises blood pressure. Measuring once in the morning and once in the evening, while relaxed and seated, is more than enough. What you're looking for is a downward trend over weeks, not perfection in days. It's also important to understand that weight loss, while helpful, is not the main driver of reversal. Many people see blood pressure drop before the scale changes. This is because vascular health improves first. Blood vessels relax, inflammation decreases, and fluid balance normalizes. Weight loss often follows naturally, not the other way around. Consistency in small habits beats intensity in short bursts. 5 minutes of daily breathing exercises lowers blood pressure more effectively than one long session done once a week. A daily walk is more powerful than sporadic intense workouts. The heart responds to rhythm and reliability. There are also warning signs that blood pressure may not improve without medical guidance. Persistent readings above dangerous levels, chest pain, dizziness, or sudden changes require immediate evaluation. Lifestyle changes are powerful, but they are not a substitute for professional care when risk is high. The most encouraging truth is this: the body wants to heal. Blood pressure rises as a protective response, not a failure. When you remove the signals that force it into defense mode, the system resets. Arteries soften. Hormones rebalance. The heart works less and lives longer. Reversing high blood pressure naturally is not about willpower, it's about alignment. When your daily habits support your biology, healing becomes automatic. This is how true reversal happens quietly, steadily, and safely. High blood pressure doesn't define you, and it doesn't have to control the rest of your life. It is not a personal failure, and it is not just a number on a screen. It is your body communicating that something needs attention, and when you listen, the body responds. Real reversal doesn't come from chasing quick fixes or living in fear of readings. It comes from restoring balance, from calming the nervous system, from feeding the body what it recognizes as real nourishment, from moving in ways that signal safety, not stress, from sleeping deeply enough for repair to happen. This process isn't dramatic and it isn't instant, but it is powerful. And it works because it respects how the heart and blood vessels are designed to heal. Week by week, pressure eases, energy returns, confidence replaces anxiety, and the future no longer feels fragile. Medication may still have a role, and medical guidance always matters. But lifestyle is the foundation that allows everything else to work better. When you change the environment inside your body, the heart no longer has to fight. If you're dealing with high blood pressure, know this: you have more control than you've been led to believe. Start small, stay consistent. Let your body feel safe again. And give it time to do what it does best: heal. If you want, I can now.